Good evening, everyone, and thank you for joining us. The inmate at York Women's Prison died of cervical cancer early last year.
A report was made and is now shining a light on how the Department of Corrections tracks health care for inmates. Channel 8's Veronica Barreto joins us live with more. Veronica?
Some serious findings were revealed in an investigation on an inmate's death at the Nebraska Correction Center for Women that happened back in 2021. I talked to the Inspector General of Corrections and he talks about the findings. A report from the Office of Inspector General of Corrections says the death of 40-year-old Nicole Wetherell could have been prevented if she would have been provided proper preventative care. The report says she was diagnosed with cervical cancer in late 2019, 9 years after undergoing her first pap smear.
And we don't fault anybody from the prison where she was at, who were providing the medical care, because what we found was that the Department of Corrections actually didn't have any way for the medical staff there to track preventative measures.
Cervical cancer, if detected on time, is nearly 100% treatable. The Federal Office on Women's Health recommends that women ages 30 through 65 receive a pap smear test every 3 years. Wetherell went 9 years between pap smear tests. By the time she died, cancer had spread to her brain, lungs, kidneys, and liver. The investigation revealed that the Department of Corrections has not followed a statute signed in 2015 by the Nebraska legislature. State law requires the agency to establish an electronic health record system.
We have over 5,000 people in the correction system who get a great deal of medical care. And when you go out to those facilities, what you see are these paper files. There's a picture in our report of these paper files, and they have to move with the individual. And that's just not an efficient way of providing medical care to people.
Wetherell was serving life in York's women's prison for her role in a man's stabbing death. She entered the system when she was 18 years old. The OIG report says she had then become a leader and received an associate's degree through a York College program. In 2018, she delivered a TEDx talk to fellow inmates and staff on a letter she wrote to herself and hoped served as inspiration for others.
Viktor Frankl said, "When we can no longer change our situations, we're challenged to change ourselves."
The ACLU of Nebraska say they've been monitoring the conditions of the state's prisons and found that the standard of health care was not adequate.
Even though people are in prison, they are entitled to a certain standard of care. It doesn't have to be the best healthcare system that people don't even have outside the prison systems, but it should be something that's standard, something that the community expects.
After her autopsy, a pathologist reported Wetherell's cancer was so profound, her female organs were not able to be identified. The OIG says if the Department of Corrections does not implement an electronic record system by 2025, they should stop the process and request funds to purchase one from an outside vendor.
All right, Veronica, thank you for that report.